So,
Do you want a coffee, tea, anything?
I'll leave you in charge of coffee and tea if that's alright. Any questions about chest injuries before we move on?
I need to get over the...
I'm in the process of uploading it, so you should be able to watch everything all over again if you want.
Okay. And the slides are on the book?
Yes, the slides on the group.
Okay.
I appreciate it's very good to watch just before you're going to bed, so we'll put you to sleep quite nicely. Yeah. Okay, so we're going to move on from breathing problems. We're now going to move on to think about circulation problems, so shock. So we're going to define what shock actually is. We're going to think about the different types of shock that we might find. We're going to think about what sort of features we will come across when someone has shock, and we'll think about how we assess it and what sort of management things that we can do, and think about considerations when someone has a crush injury and things that might be causing it. Okay. So what is shock? It's not the psychological state that people talk about. We're not talking about the psychological shock. We're talking about physiological shock. So
could shock stop someone breathing?
So it might, but it would be a secondary effect of the shock. Yes. So what is shock?
Drop in blood pressure.
So that's one of the things we might find in shock. So the definition of shock is actually inadequate perfusion to the tissues, okay? So whatever it is, so if you put a tourniquet on someone's arm, the rest of the arm below that, by definition, will be in shock because there's inadequate perfusion of the tissues, okay? Now, there's different types of things that can happen to the body that can cause it, okay? So if we think about the normal circulation, we've got the blood vessels, which are the containers, we've got the heart, which is the pump, and we've got the blood inside that, which is the fluid. And so in the normal situation, when there's no shock, you've got blood vessels containing all the blood, it's cycling around because the heart is pumping it, and it's delivering oxygen and nutrients to all the tissues as and when they're needed. Okay? When the blood pressure drops for whatever reason, so either the heart isn't able to pump properly, so you've got a pump problem, or you've got the blood vessels not able to constrict properly to keep the blood pressure there, or the blood vessels are open, for example, in an open wound, and blood is pouring out, or there's a drop in the blood volume. So if someone's very dehydrated, they lose water from the blood, and they drop the volume. That all those things can cause to what we call inadequate perfusion of the tissues. So there's not enough oxygen nutrient delivery, and that is that's the definition of shock. Okay, so it could, as we said, it could be a heart issue, so the heart isn't pumping properly. It could be the blood vessels aren't squeezing properly, so if the nerves to the blood vessels aren't telling them to squeeze properly, so they relax, and that's what we call neurogenic shock. It could be that there's an open blood vessel for whatever reason and blood is pouring out, so we would call that hypovolemic shock. So the volume is lost, or someone is very dehydrated, so again they've lost volume, so they're hypovolemic. Okay, or someone could have a medical condition where the blood vessels have all relaxed, so a severe allergic reaction causes it, so what we call an anaphylactic type of shock. Okay. It could be a psychological cause for it, which is where people faint. So they've had some sort of thing, the brain has therefore relaxed all the blood vessels, and they've dropped their blood pressure. Okay, so all these things can happen, and it can be a combination of these, or it can be one as an individual thing that has triggered it. Okay, does that all make sense?
Yeah.
The outcome is all the same. You don't have enough blood flowing to the tissues, but it's either because there's not enough pressure in the system, the heart isn't able to pump it properly, or there's not enough liquid in the system. Okay? So what would a patient who's in shock look like?
Be pale.
It might be pale. Why would they be pale?
Because the blood is as withdrawn from the extremities.
Yes, so we're trying to keep the blood going to where it's needed, so we're not going to be able to let blood flow to the skin, so it will look pale. What else might be found?
Confused.
They might be confused if they're not getting enough blood flowing to the brain,
No
absolutely.
capillary response.
So they'll have a long capillary response, absolutely, exactly as we said. Where the blood isn't we're trying to conserve the blood to where it's needed, so it's not going to the capillaries in the fingers. What else?
Cyanosis then.
There might be sinus, but it's less likely because what's the
Oh,
problem?
sinus is the oxygen rather than the
yes.
yeah.
Yeah. What else might we find?
Weak and shaky, those kind of things like that.
So why would they be weak and shaky?
Because there's not enough oxygen
Going to the brain, so they're not functioning properly. Yeah.
Which means they might be speaking incoherently.
Yeah. So they'll be confused.
Yeah.
Yeah. What else might we see? What sort of things might we find when we examine them? So we've spoken about they might be pale, long capillary refill time.
Might be cold as well.
They might be cold because they're not getting blood flowing to the skin.
Yeah, like cold sweat as well.
They might have a cold sweat, so that's an adrenaline response, so trying to get the blood pressure up, and part of that response causes the body to sweat. Not that the body needs to sweat. So they'll have that cold, clammy look, yes, very sweaty.
Would they be floppy as well at the same time?
If the brain's affected, so there's a reduced level of consciousness, what might happen to the heart rate?
Go up.
It might go up if the heart is trying to compensate for lack of pressure,
Yeah.
or if it's a heart problem, it might go down. So they might have an abnormal heart rate. What about feeling for the pulse?
Oh, they might have a weakened pulse.
They might have a weakened pulse. Yes.
Well, not yeah.
They might have a weakened pulse because there's not enough in the system,
Also
pressure in the
have,
system.
like fast pulse.
Yeah. So it might be very fast and weak, or it might be slow and weak because there's not.
Thready.
Yeah.
Sort of.
That's thready, yes. So we all know what our normal pulse feels like, and it might just be quite difficult to feel because it's not as strong. What might their blood pressure be doing?
Does it fluctuate?
Low.
It might be low. Yes, it might be normal. It might.
Can I say probably below?
It would probably be low. You're absolutely right because by definition in shock there's inadequate perfusion, so it should be low. But the reason why I say probably, not definitely, is because we have mechanisms to try and to help it to control the blood pressure. So you might still someone might be developing shock, even though their blood pressure has still not yet dropped down to correspond to that. Okay. So how might we treat shock?
Depends what's causing it.
Depends what's causing it. Absolutely.
Yeah.
So what sort of things might we do?
So it depends. If you have penetrating trauma, so
Yes.
basically
Stop the bleeding.
The bleeding.
Yeah. So turn off the tap.
Yeah.
Absolutely. Yes.
And then
Make sure they're in a comfortable position. They're not going to hurt themselves if they do fall over
Yeah.
or faint.
So yes.
but then we supply liquid to the body. Some sort. I think it's FREC 3.
No, it's that's paramedic level, but yes. So you might think getting someone with more advanced skills to
Just like I said, I'm very confused here because in Israel I did the Chovesh course.
yeah.
So the
So
first day we learn how to.
Chovesh is FREC 5.
I know.
Yeah.
Oh wow.
But I remember
Yeah.
nothing of it.
Yeah. So we might be thinking about how we can.
Yeah.
So we might think about how we can replace that fluid that's missing. Absolutely. Yes.
Is that when you would say IV fluid wide open?
Yeah. Yes. You might. But what's the problem with giving someone IV fluids?
If you could dilute the blood.
You can
too much.
dilute the blood, absolutely, yeah. So you need to, so you're right, you might want to do that, but you need to do it carefully. Okay? What else can we do?
If it's anaphylactic, then you give adrenaline.
Yeah, so we can treat the cause if it's anaphylactic.
Give them oxygen
Yes, why would we give them oxygen?
because their oxygen might be low.
Yeah,
They might be struggling to get
they
that
might be
oxygen.
struggling to get it, so it's about optimising that, absolutely.
Do we check the oxygen level before we administer oxygen, or is just we just take it from there?
So there's two ways to give oxygen, and I think we spoke about this previously. You can either start high and work your way down, or you can start low and work your way up. But it's what we call targeted oxygen. Okay, so we want to make sure that they've got enough oxygen for what they need, but at the same time not give them too much.
With the Would the oxygen meter would it actually read correctly if if they're like they're saying there's locally
So what,
refilled,
so what do you
like that?
think? If you put an oximeter on someone's finger, and they're in shock, what might we get on it? What might it show?
An error.
It might show an error, absolutely.
Yeah.
So, and why would it show an error?
Because the blood doesn't reach the.
Absolutely, exactly. So,
Right.
so you might get an error. So then you'd have to be cautious and give them more oxygen, okay? Because the problem is that they're not getting enough oxygen going around the system. So you'll give them high flow oxygen while you're not sure.
So when would you use the life factors to put the various details on?
What, the ECG?
Yes.
So what's the ECG looking at?
So it's monitoring the rate of the heart.
Yeah.
What it's doing.
Yes, so it's monitoring the electrical activity of the heart. So it's telling you what the electrical activity of the heart is doing. The pulse oximeter is telling you how much oxygen is getting to the finger. Yes? So we use all these different bits of information to build up a picture of what's going on. So you might use the ECG to check to see what the heart rate is, because you can't feel the pulse in the wrist. Okay, so you want to see, is it fast, is it slow? Yes, can you feel it in the carotids? Yeah?
Yeah.
What does it feel like? So the ECG might give you that bit of information. The pulse oximeter might give you information as to how well the finger's being perfused. If it's got a very poor trace, that tells you that there's not a lot of blood flow going through it there. As opposed to if it picks up a nice waveform, you know there's plenty of blood flowing through the finger. Useful information,
Yeah.
but it's just information to help you look at the patient. Does that make sense? Okay? What else can we do to help the patient who's shocked?
Try to calm them down.
Yeah? Well, we're not talking about psychological shock, but they might be panicking because of it, so yes.
Yeah.
So telling them, I'm here to look after you is quite important, because if it's a heart problem, having all that adrenaline running around the system because they're panicking might make it worse. Yeah?
Managing the temperature, if you're hot or cold.
Yes, making sure that again, trying to optimize things. How can you give the patient fluid without doing a cannula? And
Yeah,
things?
something, maybe something, yeah. Something
So you might be able to give them to drink, absolutely.
Yeah.
If they're very dehydrated because they've had diarrhea and vomiting,
If I would give something sweet, would it help as well to prevent?
it doesn't matter, it's the water really.
Okay.
So if they're awake enough, you might want to give them something to drink, absolutely. What else can we do if they're not awake enough? What do we do for people who faint?
To lift the
Yes, we can lift their legs, absolutely. Legs are a big part of the body, they have a lot of blood in them. You can give someone essentially a blood transfusion by lifting their legs up, can't you? So you might want to lift their legs up to help the blood flow from the legs go back to the body. Yes, remember we said there's poor peripheral perfusion. There's still a bit of blood flowing around those, but you don't need the blood going to the toes. You need it going to the brain. So if you lay them down and lift their legs up, the blood will flow more easily to the brain. Absolutely. Okay. Ideally we don't want the patients to eat, smoke or drink because they're not well and we don't know. But you're right. If they're awake enough and you think the reason is that they're in shock is because they've become dehydrated, you might want to see if they can drink. Okay? Think about where we are in that patient's journey as well. Okay.
Does it easy automatically then divert blood to
It
start
diverts to
digestion
the,
as well?
yes. So you wouldn't want them to eat because the risk with that is that they'll divert blood to the stomach and also they might vomit. But it might be that if they're awake enough and not too bad, you might say, well, you've been having diarrhea for the last 24 hours. Probably you need more liquids and maybe try and drink a little bit. But you need to balance that to where you think the patient is. If they're really shocked and they're starting to lose consciousness, do you really want them to have a full stomach? Yes? Okay. It says there about loosening clothes. What do you think about that?
Yeah. So,
Loosening people's clothes.
Reduce pressure.
Yes, it's about reducing that pressure, allowing the circulation to work more efficiently.
yeah, especially if someone with like a skin.
If someone has a tight tie on, and I know you're very nicely dressed and everything, but think about it's putting pressure on the veins in the neck. If the circulation is struggling, try and just reduce that pressure. Doesn't mean you need to undress them, but it just means loosening their clothes. So it might just be opening the top button of their shirt or something like that. Okay. Any questions about shock?
Not at the moment.
Not at the moment.
Question I will ask, if we come to a point which is like a heavy bleeding, so
Yes.
the first intent would be first to put like turning if needed,
Yes.
and then to lift the leg.
Absolutely, yes, because there's no point in giving
Just
them all the,
emptying it,
emptying all the blood from their legs into the body for it to come out from where it's bleeding, is it? So if they're actively bleeding, first thing is turn off the tap, stop it bleeding. So direct pressure, wound packing, tourniquet, as in a stepwise approach as we've discussed. Then once you've managed to get control of that, then pick their legs up so as to optimize the circulation as much as you can.
Can shock turn into seizures?
So anything that disrupts the brain function can cause seizures. Okay, but shock itself shouldn't cause seizures. Okay. Okay, happy with that? Okay, so now let's think about the different types of wounds that we can come on, because as you mentioned, we want to turn the tap off. So let's think about the types of wounds that we might come across that might cause shock. Thinking about how we can estimate how much blood that is, okay, and what sort of things we can do to try and manage that. Okay, so we've spoken about dressings, tourniquets, etc. Okay. So, how much is 10% of your body volume of blood?
600.
It's about 600 mils, yes. It's about the amount that they take from you if you donate blood at a time. How do you feel at that point?
Dizzy.
Most people feel absolutely fine with it. Yeah. Most people can donate a unit of blood, and then as long as they drink enough beforehand, afterwards they get up and then no problem. Yes.
How much is a unit of blood?
About 500 millilitres, about a pint. Okay, so it's just under 10% of your blood volume. Okay, so if people lose 10% of their blood volume, most people will feel absolutely fine. However, that is the definition of the first stage of shock. So there's 4 stages. First stage is about 10% blood loss. Okay, so most people will be absolutely fine with it. And you won't see anything different. So the consciousness level will be normal, their skin will look normal, it will be warm, their capillary refill time will be normal, their pulse will feel normal, and the breathing will be normal, because people can cope with that. The body is able to divert blood around, and it will replenish that blood loss within a few days and not cause any major problems. Okay? Once you start losing more than that, and when you're starting to get towards stage 2 shock, which is 20%, then the body starts losing that ability to compensate for it. So the first thing is people will feel is faint, because when they stand up, their blood isn't flowing to their brain properly. So when they stand up, they'll feel dizzy, they'll feel faint, they'll want to sit down, they'll want to lower their head, they might want to lie down. Okay. They might have a bit of pale skin. Again, the body's starting to compensate for the loss. It's diverting blood towards the more important organs and away from the skin. The heart will try to compensate for that and will start beating a bit faster. Okay, and again, because we're starting to develop shock, and the problem is that we're not delivering enough oxygen to the tissues. The body will start trying to compensate for that by increasing the respiratory rate to try and optimize how much oxygen we're absorbing. When blood continues flowing, when the blood pressure continues dropping for whatever reason of shocks, the circulation is continuing to deteriorate. So oxygen isn't getting to the brain, so we'll start getting reduced levels of consciousness. People will become more restless, they'll become more agitated, they'll become anxious, they might become combative. Because all these things happen, so the brain isn't functioning properly. Their skin, they'll become much more pale because they're not getting blood flowing there. They might starting to develop that cyanosis because the blood again isn't flowing, they're not getting that oxygenated blood to the skin. And we already mentioned they'll get this adrenergic response to try and optimize the circulation, so as part of that, the skin will become cold and clammy as a part of a reaction to that. The heart will definitely be trying to compensate for it, so the heart rate will continue climbing and going up, and the blood and that pulse might start feeling quite thready and weaker because there's not enough circulation going around. And the breathing will definitely be much faster because again we're trying to optimize that oxygen delivery, trying to compensate for things. Once we get to about 40% blood loss, so we're talking about 2 litres, okay, so the person becomes unconscious because there isn't enough blood flowing to the brain, so the brain isn't able to function. There'll be cyanose because again there's no blood flowing to the superficial tissues. You probably won't be able to feel the pulse at that point because the pressure is so low that although there might be a circulation, it's just not strong enough to feel. And the breathing pattern changes to, rather than being very rapid, it's trying to get this deep sine type breath, which is really trying to get as much oxygen in as you can, but it's just really struggling to do that. So you get this sine type breathing. Almost like and they almost look like they're hungry for air. And you all know what hungry people look like. You see someone hungry rushing into a meal and their mouth open, getting ready to stuff as much as they can in. So the same thing, but trying to really almost inhale as much air as they can. Okay? Does that all make sense?
Is that similar to agony or not?
No. So it's a deep. So it's quite literally like this. A deep sighing breathing. Agonal breathing is very irregular, almost like a fish out of water. Do you remember the video that we saw from Bondi Beach?
You didn't see it.
You didn't see that. Let me just pause that and see if I can bring it up.